Hi everyone, this is Sidra, and today we'll be talking about the anatomical position, the planes in the body, and the terminology used to describe various parts of the body. So now let's draw the human body in an anatomical position. You should be upright, your eyes facing forward, your ears should be in the horizontal plane and in line with the lower part of your orbital ridge, so that's the hard part underneath your eye. Your face should be in a neutral expression, arms by your side, palms facing outwards, and your thumb at a 90-degree angle. Your legs and feet should be close together, and your feet should be pointing straight forward. So the anatomical position is used as a standard reference, allowing doctors and scientists to communicate with each other and know exactly what position the body should be in. You should always examine the patient in the anatomical position to make sure that you can relay your findings correctly and that your findings are correct, because if somebody's head is tilted, you can't tell whether their neck is okay or not, if that makes any sense. So now let's talk about the planes. There's 3 planes that you can divide the body into. One is a midline plane. It's called the sagittal. It doesn't have to always be midline, it can be towards the side as well, but the medial sagittal plane divides the body into left and right portions, and when you look at this view, you'll see the side view of the body. Then of course you can divide the body into top and bottom parts. This is called the axial or the horizontal plane. So now imagine taking a log and chopping it in the midline. That's cutting the log in the axial or horizontal plane. Same with magicians, sawing the body in half. The next is called the coronal plane, and it comes from the word crown. So imagine taking a cut through the head where you wear the crown. Or imagine a loaf of bread and dividing into different slices. The plane that you're looking at is the coronal plane, and you can remember it by the word cut, C for coronal and C for cut. This will divide the body into front and back portions. With the log, if you put it upright, you're dividing it into a top and bottom half, and then making it lie down. And with the loaf of bread, the head is on top, the feet are at the bottom, and you're cutting through the head. I hope I have made that clear enough. Let me know in the comments. Now let's talk about some terminology that's better than saying top or bottom or left or right, because that can differ from where you are and which way you're looking at the body. So anterior is saying in front of or ahead of, and posterior refers to something being behind or at the back. You can say superior for something being above and inferior for something being below. Next, if something is pointing towards the midline, it's called medial, and if something is away from the midline, it's described as lateral. Something can be far away from its origin, or distal, and something can be close to its origin, or proximal. Another word for saying above is cephalic. It's usually used in embryology, where the embryo is folded. So instead of saying superior or inferior, because you don't know what the orientation is in the womb, you can say cephalic versus caudal. Caudal is the tail end. So the hand can have a palmar aspect and a dorsal aspect, and the feet, the dorsum is what you can see when you look down, and the sole of the foot is also called the plantar aspect, because you plant it on the ground. Rostral refers to the nose, and it's usually used in neuroanatomy to describe the orientation of the brain. So the end of the brain that's closer to the nose would be described as rostral, and that would make it easy to orient yourself in a CT scan or MRI, whatever you're looking at. Superficial and deep are used to describe wounds and also closeness to the skin. So for example, bones are deeper to muscles and muscles are more superficial. Last but not least, organs can be unilateral, which is one-sided, or bilateral, which is present on both sides. Now let's consolidate everything that we've learned with a little quiz. Please pause the video after the question's been asked, try to answer it yourself, and then you can compare the answers with mine. For the first question, let's try to describe the position of the heart in the body in relation to the other structures present. Try to think of what might be above or below the heart, in front of it, behind it, and to its sides. The heart is a central organ. It's more towards the left than it is to the right. On either side you have the lungs. In front of it is the anterior chest wall. Behind it is the descending aorta or the mediastinum. Above it you have the aortic arch, and below you have the diaphragm. Next, let's try to describe where the nose is on the face in relation to the other structures present there. Again, think about what's above, below, and towards the sides, in front of, behind it. The nose is another central structure. It lies in the midline and medial to the inner corners of the eye. On its lateral sides, it has the cheeks. Inferiorly, we have the lips, and superiorly, the forehead is present. The last question is to describe the elbow joint. The elbow joint is made up of the distal end of the humerus and the proximal ends of the radius and the ulna. This is principally why I put this question here, to actually be able to use these words in context, and I hope that helped. Last comments, you can combine all of these words together. So if you wanted to say something is in front of but also above something else, then you could put anterior and superior together and say anterior superior. Same with anterior inferior, anterior medial, and anterior lateral. If you wanted to describe something as being behind and towards the midline, then you'd say posterior medial, and you can combine posterior with posterior lateral, posterior inferior, posterior superior. I'm going to attempt to explain the planes, the anatomical planes on this mango by cutting it up. So you've got the head of the mango, and this is the tail end of the mango. And if I cut horizontally along the x-axis, this is what would be the axial section of the mango. And then if I cut through the middle, this would be the sagittal section of the mango. And since I cut through the middle, this is the median sagittal. And if I cut a little bit to the side of the middle, this is just another sagittal section. And then if I put this mango up straight and bring the knife down from up above through the crown of its head, this is the coronal section of the mango, and this is what it would look like on the film. Okay, and then to explain deep and superficial, the terms deep and superficial. So deep and superficial are always used in relation to the surface of the body, and the surface of this mango's body would be the skin. And if you look at it, the pit is the deepest structure that we have. Then the flesh would be superficial to the pit. And then when we talk about the skin is the most superficial structure, and we'd say that the flesh is deep to that. We can also talk about deep and superficial in terms of wounds. So if I cut this mango a little bit, this is a superficial wound, and then if I make a deeper cut, that's obviously a deep wound. Alright, thank you very much. I should mention that anterior is also called ventral and posterior is also called dorsal. If you like this video, please give it a thumbs up, subscribe to this channel, and hit the bell icon to be notified regarding videos every single or every other week. Take care. Bye.